Top COVID vaccine advisor has reportedly resigned from her role at the CDC. Reuters reporting the official stepped down as the co-leader of a group that helps shape the agency's COVID vaccine recommendations, telling colleagues in an email that her decision was based on the belief that she is, quote, no longer able to help the most vulnerable members of the U.S. population. The resignation comes after HHS Secretary Robert F. Kennedy Jr. made a major change in the COVID vaccine policy last week, declaring the CDC will no longer recommend COVID-19 vaccines to healthy children and healthy pregnant women. That move reportedly blindsided CDC officials who learned of the new directive from social media. Joining us now, former commissioner of the U.S. Food and Drug Administration under President George H.W. Bush and Bill Clinton, Dr. David A. Kessler. He also served as the chief science officer of the White House COVID-19 response team under President Biden. Dr. Kessler is author of the new book entitled Diet Drugs and Dopamine, the New Science of Achieving a Healthy Weight. We'll get to that in a moment. Definitely want to talk about that. But first, Dr. Kessler, your reaction to this major change in COVID vaccine policy.
Vaccine policy has to be based on the best science. It can't be based on politics. First term, one of the great accomplishments of President Trump, Operation Warp Speed. We were able to get those vaccines to the American public because we had the infrastructure. We had the scientific expertise. What I don't understand, his greatest accomplishment, now they are taking down that infrastructure, and that concerns me greatly.
So, Dr. Kessler, I mean, it's more than just, of course, these vaccines. It is shifting recommendations as to how to, doctors should administer care. It is, of course, also slashing medical research grants and funding, really upending what these agencies do in the name of making America healthy again. So, there have been, some of Robert F. Kennedy Jr.'s goals ahead of that department, noble, have been praised by bipartisan fashion. Others decidedly not. What is your sort of big picture concern about where you're seeing here in terms of the health guidance the nation is receiving?
I think RFK Jr. has tapped into this populist chord about food. No doubt that this ultra-formulated food is addictive. These new anti-obesity drugs can help crack that addiction. We can reclaim our health, but we need to do it the right way, and that's why I wrote the book.
All right, we're going to move to the book. Popular snack foods that could come with new label in Texas. They're warning that the ingredients might not be suitable for human consumption. NBC News correspondent Sam Brock has the details on that.
This morning, a new potential state law in Texas could change the way Americans eat snack foods nationwide, requiring a warning label on many popular food and drinks, reading not recommended for human consumption. It's targeting products using ingredients like bleached flour, food dyes, sweeteners, oils, and preservatives. Those are legal and common in many processed foods in the U.S., but some have faced regulation in other countries. According to USA Today, the proposed rules could impact a wide range of processed foods and drinks, from Doritos to snacks like Twinkies, Ruffles, and M&M's, to breakfast cereal, to drinks like Gatorade and Mountain Dew.
Do the do.
If the legislation is signed by Governor Greg Abbott, Texas would become one of the first states to require the labels, potentially reshaping national food industry standards. The bill would mark a victory for HHS Secretary Robert F. Kennedy Jr. and his Make America Healthy Again movement. Kennedy testifying last month, saying that processed foods are a potential health danger for consumers.
The food industry really is not profiting from keeping us all sick, but it is keeping us sick.
Some food industry experts disagree with the legislation. John Hewitt, Senior Vice President of State Affairs for the Consumer Brands Association, urged the governor not to sign it. In a statement saying, quote, the ingredients used in the U.S. food supply are safe, adding it would create legal risks for brands and drive consumer confusion and higher costs. This comes as some companies are working to remove artificial dyes from their products after the FDA announced a ban on red dye number 3 earlier this year. Testimony from a natural food company CEO last year going viral, showing how American companies are selling the same products without artificial dyes in other countries.
This is the brightness of the Canadian version, just for visibility. And this is the brightness of artificial food dyes.
Now, some food for thought on how standards could be shifting in the United States.
All right, so Dr. Kessler, this story speaks to one of the major issues that you discuss in your book, the dangers of processed foods. Tell us about it. I feel like you can hardly find food that's really good for you in a grocery store.
No doubt that the American body is ill. Only about 12% of us are metabolically healthy. Only 12%.
Wow.
When you look at blood pressure,
12%.
blood lipids, right? But let's understand what the real culprit is. However laudable going after food dyes are, I mean, the real problem is that fat and sugar, fat, sugar, and salt that we put on every corner, made available 24/7, made socially acceptable to eat anytime. We're living in a food carnival. But the real problem is that toxic fat, as I call it, that fat around our midsection. That fat gets into our liver, our pancreas, our heart, and that's causing chronic disease. We need to be focused on the real culprit, and that's this toxic fat in our bodies.
Right. So then we have all these weight loss drugs that are extremely effective. And we have the problem of obesity in America. Recent study shows that obesity is up in teens. At the same time, it seems like you're painting a picture of, this incredible amount of processed food in the American diet. And now you've got these weight loss drugs that help people from perhaps being addicted, controlling their addiction to the processed foods, which are, by the way, addictive. How is that cycle going to ever make America healthy again when now you have drugs to help you from keeping the food that isn't eating the food that isn't healthy?
Yeah, you're exactly right. Look, these ultra-formulated foods are addictive. These GLP-1 drugs, these new anti-obesity drugs, they can tamp down the addiction. But you have one industry making billions of dollars, making us sick. You have another industry making, equal profits, treating what the former does. I mean, if you were from another planet and you came down and you saw what we were doing, you would say, hey, fix that root cause, get to that real problem. I mean, and it's our food. But, Mika, we can't wait. I mean, for the many people who are struggling with their weight, this mystery of weight, this food addiction, I mean, we have to give them the tools to be able to reclaim their health. And these drugs are one tool, just one tool, not a panacea to reclaim our health. So very important.
The new book, Diet, Drugs, and Dopamine, The New Science of Achieving a Healthy Weight, is on sale now. Author and former FDA Commissioner Dr. David A. Kessler, thank you very much for coming on the show this morning. We appreciate it.